my feel-good breakfast show.
You're still with your feel-good breakfast show, Expresso, right here on SABC3. Now, during the lockdown, a psychiatrist, Dr. Shakir Salduker, together with public health specialist Michael Wilson and DUT professor Monique Marks have come together to start the Durban COVID-19 withdrawal management program to help many of their homeless patients. Dr. Shakir Salduker joins us on a video call this morning. Thank you so much for making the time. Good morning, Doctor.
Good morning, and thanks for having me on your show.
Doctor, such wonderful work you're doing, but why did you feel it was important to start a drug withdrawal program for the homeless during this lockdown?
So the COVID-19 pandemic created a series of knock-on effects, one of which was the need to get the homeless people off the streets and into safe spaces. And we know for a fact from studies that were done that 60% of these people that live on the streets are addicted to some or other substance. More particularly in Durban and in Johannesburg, we have a problem with wunga or heroin or nyope as it's called in other places. So we realized that, within days of them being taken off the streets, their supply would be cut off and they would go into a state of quite severe withdrawals, which can be life-threatening in some instances, but very, very difficult to manage in most cases.
And how successful has the program been? What would healthy expectations for success look like in the program?
So the essence of somebody who has been taking a substance of abuse or dependence for a long time and then suddenly stops, without any weaning period or any kind of assistance, they go into a thing called withdrawals. Withdrawals means that people become extremely physically uncomfortable, mentally challenged, and they struggle, and as a result, the effort to keep them contained in a lockdown environment where you don't want chaos, where you want order and structure and social distance or physical distance and so on, it was crucial to make sure that the withdrawal symptoms were kept to a minimum, and the success was actually it was quite stunning because we didn't expect it to be that successful. We thought we'd be able to help them, but within a period of time, most people were, within a period of 3 to 4 days, in fact, most people were virtually symptom-free, much easier to police and manage within the lockdown environment. And, just as an example, prior to the program starting, there were between 20 to 30 people escaping per day in search of drugs outside of the shelter. And from the time the program started, not a single person tried to escape subsequently. Oh. So it has been, from that point of view, from a containment point of view, extremely successful.
You're doing such a good job there. And I mean, those rates and those success sort of figures, they speak for themselves. And it means that the intervention has been effective to that effect. Now, many of the homeless, they're now also getting essential care for other health conditions like diabetes, HIV, and much needed counseling. Please tell us more about that.
So the other advantage of having people in a contained environment where you have access to them on a daily basis is we get to screen. So a lot of people were screened for TB and HIV during this time, and there were many cases, undiagnosed cases that were picked up, which is phenomenal, obviously. And also many people who were already on ARVs for the HIV who had defaulted and fallen off the treatment program were reinstituted into the treatment program. And during the process, we had multiple NGOs and, in fact, the City Health Department assisting with screening of multiple health conditions. So not only were they being assisted in terms of their substance use problems, but many other physical problems were also addressed during their time. It was an amazing coming together of government and non-government organizations to provide an extremely comprehensive service and environment for this group of people, starting from food and bedding and clothing to medical care and obviously psychosocial counseling. We had social workers on board who were reconnecting people with their families, counseling them. And you must remember, many of these people were for the first time in years. I'm talking 12, 15, 20 years, not using a substance or being on some form of formal treatment. And so I mean, it's really been an amazing transformation and a really feel-good story for many of them.
Now, seeing the positive impact that this program is currently having, and I mean, it's a big one, do you plan on continuing it after the lockdown has ended?
That is the plan, and we've had some really good input from our deputy mayor in the eThekwini municipality, Belinda Scott, who's been very instrumental in helping us get sites that we could continue to keep people who are interested to stay on the program for a longer period. And we're looking at hopefully instituting the first harm reduction center in the country on a site that is probably, we hope, going to be provided for us to do that. And that includes a space where people off the streets could come and get assistance for many things, including their use of substances, but also medical conditions and so on. So yes, we do have plans to take it forward. Obviously, we're going to rely heavily on funding and donations, and we're going to have to try and logistically. Remember, all of this was done in the space of weeks, and that kind of initiative to take it forward takes a lot of planning and definitely a lot of funding. So, watch the space. So we're hoping it's going to work out.
Dr. Shakir Salduka, it is so inspiring to hear the tale of how you've been able to do and put all of this together in just a matter of weeks. Imagine what that sort of effort multiplied over a longer period of time can do, and the amount of good and the positive impact that you can roll out across the country. This is much needed interventions, and we do thank you and your associates for coming together and really bringing this work together in such a magnificent way.